Grateful for the millions of people around this region who have answered the call, who've turned their lives These are serious actions in this crisis, taken lightly. We're leaving these are tactics needed to provide for the safety of our community and our public health officer, and we're Duchin will be able to speak more about the details in a moment. We will be continuing to consult with all of our cities. There are 39 cities in King County about additional actions they believe they need to respond to local conditions in their jurisdictions. I want to take a minute to thank Dr. Duchin, Public Health Director Patty Hayes, and their team. They are working around the clock for our community. It is time right now for people to assume that they and everyone they meet has been exposed and is potentially infected, to avoid any unnecessary interactions that might lead to further infection, and to wait and monitor and see if they in fact have been infected so that they can isolate and recover without presenting a danger to others. Go to work if you must, but hunker down if you're able. Postpone anything you can. Treat the next 2 weeks as a period of self-quarantine to protect yourself and the lives and health of your loved ones and of our community. I am well aware of the hardships we've asked our residents to endure. And while I'm heartened by the support and understanding of so many people across the region, I also appreciate the anxiety felt by many in, for example, the restaurant and entertainment industries. Back in World War II, there was a national push for people to buy war bonds. In that same spirit, I'm urging everyone to patronize their local restaurants and coffee shops at a safe distance. If this pandemic is symbolized by the medical mask, then perhaps our resilience is going to be represented by the takeout box. I also ask you to join me in supporting the arts. If you plan on donating to an arts organization anytime this year, please do it now and take the time to donate to one of the many charities that's helping the people who are employed in the arts to get through this period. People have been put out of work either because they're artists or because they work backstage in the arts, to be able to pay their rent, to be able to put a meal on the table. And if your event is canceled, whether it's a charitable event or an arts event, please don't ask for a refund if you can afford it. These organizations need those funds to get through this time right now. Consider your ticket a contribution to a worthy cause. We can all play a small part in helping our economy and our neighbors, helping them hang on until the day we can lift these orders and eventually get back to life as normal. Today we are focused on the response, but in the coming weeks we must also focus on the recovery. It is my honor to introduce to you the Governor of the State of Washington, Jay Inslee.
Good morning. I want to thank members of the media who are accommodating our need to socially distance. We appreciate your cooperation and not shaking hands and maintaining 6 feet to the extent humanly possible. We thank you for your leadership in this statewide and national effort. Given the explosion of the COVID-19 virus in our state and globally, I will sign a statewide executive proclamation later today temporarily shutting down restaurants, bars, entertainment, and recreational facilities. This order is operational for 2 weeks and obviously may be extended. The reason is quite clear. We represent about 2% of the population of the United States, but we represent over 20% of the infections. Today it's 796 infections. Never since World War II have we faced a situation like this where we both can be part of this battle, but must be part of this battle. This is bigger than all of us, and I am fully confident that Washingtonians will rise to this challenge to get back to a normal state of our life as soon as humanly possible. But all of us have to recognize for the next several weeks, normal is not in our game plan. And I will be announcing both mandatory rules in this regard and a request for Washingtonians to understand that central premise. As Dow said, these decisions are not taken lightly. I know there are enormous economic implications and social disruptions. And in the days to come, we will attempt to do everything we can to minimize and help mitigate some of these challenges. But today, we know we are doing this for a simple reason, to save lives of our loved ones in Washington. And I want to reiterate here, hours count. It's not that weeks count, hours count. And so we need very strong measures to reduce the extent and pace of this infestation. This is our only weapon available to us right now. I want to reiterate that. We are not powerless against this virus, but we have one effective means of defeating it, and that is distancing ourselves from virtually everyone else in the state of Washington. Restaurants will still be allowed to provide takeout service and delivery services, but no in-person on-site dining or drinking of alcohol or coffee or anything else will be allowed under this order. Sit-down food service. Other retail outlets that can play an enormous role in this must designate an employer or officer to implement a social distancing plan for the operations of their business. So I want to go through what is included in this ban. Restaurants, except for takeout and remote delivery. Food courts, bars and taverns, coffee shops, donut shops, ice cream parlors, wine and beer tasting venues, breweries and distilleries, beauty salons, barbers and nail salons, tattoo parlors, theaters, bowling alleys, gyms and fitness centers, non-tribal card rooms, museums and art galleries, youth sports and youth clubs. Permitted to continue, among other things, are grocery stores and pharmacies. I do want to be clear about this, though. The supply chain is strong today, and grocery stores will continue operating and providing services to Washingtonians. And I want to thank people in that industry for working day and night to make sure that that will continue. We all are in this together, and we don't want to stress the supply chain unnecessarily. So when you purchase things, this is a moment to think of your neighbors, not just your immediate family, so we can keep this supply chain open. We're keeping open pharmacies, child care and daycare facilities, school-based food programs for K through 12, convenience stores, and banks. As I mentioned, food or beverage services must move to delivery, takeout, or grab-and-go service, even at airports and in dorms. Additionally, all gatherings for social, spiritual, or recreational purposes with over 50 participants are prohibited, and all similar gatherings under 40 participants are prohibited unless previously announced criteria for public health and social distancing are met. Now, that is an order of the governor, but I want to speak to every leader of any organization, private or public. If you're thinking about having a group with 49 people in the same room, think again. You need to figure out how not to have meetings of any size if there is any possible opportunity to get your work done in a different way. We need your leadership more than ever to make sure that that fundamental common sense rule is followed. This morning, I spoke with other governors to the president and the vice president and some of that leadership. There was a wide variety of subjects discussed. The one that is particularly important to the state of Washington is the maintenance of our personal protection equipment for our medical system and our hospitals. This is something we are very concerned about. The federal stockpile that has hundreds of thousands of personally protective equipment has been responding to our orders, but we are going to have to increase our orders fairly significantly, and we need that federal stockpile to be able to fulfill our state stockpile. I was pleased that a request I made to the president will be granted, and that is that we change our national priority system so that we can get personal protection equipment in the state of Washington. Previously, the system essentially had an allocation as a certain percentage to each state, essentially on a percentage of population basis. I argued that that is not adequate to the task because we have 700 plus infections right now, and West Virginia essentially has none. So I believe the president will change that prioritization, and he said he would shortly, and I think this will facilitate Washington getting more personal protection equipment as soon as humanly possible. So that was helpful discussion, and I appreciate it. So here's kind of the rule going forward for all of us. It doesn't matter if we're a business leader or a working person or a grandparent or a grandchild. If we are living a normal life right now, we're just not doing our job as Washingtonians. It's much, much too dangerous. We can't do that anymore. We need to make changes to our personal and family lives, regardless of size. And think about where you're seated in all occasions. We have simply got to limit the number of people who come in contact with this virus. 6 feet between us ought to be the rule in every circumstance. Now, I want to say something really strong to some of our most loved ones. And those are the people who are age 60 and over, and those people who have some underlying health condition. You are at substantial risk because of this virus. Let me give you a reason I say that. We are fortunate that our younger population has a very low rate of infection or mortality if you are infected. The most recently available information is that if you're under 50, you might have a mortality rate of 0.4%, and it gets lower as you go lower on the age chart. But if you were over 80, the mortality rate can skyrocket to 8 to 18%. From the 70 to 79 provision, it is 8%. And if you were over 80, it is 14.8%. Anyone in this category, I want to make a very personal and gubernatorial request to you. You need to self-isolate, starting right now. And that means you need to change the way you operate your life. If you've every Saturday met your buddies after a basketball game like I did for 20 years, you just can't do that anymore. If you've wrestled with your grandchildren every Saturday morning like I've done for years, you just can't do that anymore. If you've gone to a museum with your friends on a Sunday afternoon, you just can't do that anymore. Now, this is not a legal statement by the governor, but it is as strong a recommendation as I can possibly make. And we as Washingtonians have to help our loved ones follow that admonition. If your grandma is going out, she's not going to go to the restaurant anymore because of this rule, but if she's going to an art gallery, no, you need to talk to her and say you're not going to do that for a couple weeks at least, and probably longer. And if you see them playing with your grandkids and wrestling on the floor, you can't do that. And we need to save these people. Because if we can keep this group of people out of circulation for the next several weeks, we're going to save dozens, if not hundreds, of our loved ones. So that group of people, I strongly recommend self-isolation at this moment. Now, those of us who are under 60 and are healthy do not have underlying conditions. I also agree that you ought to look at your life and figure, what do I really have to do when I leave my house? I mean, what is really required for my family's health or general living? And if the answer is you really don't have to do it, stay home. You just got to stay home unless it's absolutely necessary to go out. And this is tough. Look, we're social animals. We want to be with our loved ones. We've spent, in my case, 69 years offering my hand to anybody I meet. But we can't do that anymore. Okay. I want to address our medical situation. We are very aggressive attempting to build our surge capacity in our hospital system. This is very difficult because unless we are successful doing what I'm suggesting, which is everybody stays 6 feet away from everybody else under all conditions, we're going to have a real strain on our hospitals. We have a plan to do all we can in this regard, but everybody's got to pitch in, including, frankly, you are going to, if you have really non-necessary surgery that could be delayed without a risk to your health, you probably are not going to be having those procedures for some period of time. And we're having discussions with our hospital and medical community about that just actually this afternoon. I want to thank Dow Constantine, Jenny Durkin, Dave Summers, and all the leaders with me. And I want to say that I'm really proud of what Washingtonians are doing right now. They are responding, and that's been very pleasing to me. I just want to finish by something that really inspired me the other day that I hope we keep in mind. Our Superintendent of Public Instruction, Chris Rakedahl, when we announced our school closure, told a little story about how he was watching a 14-year-old girl playing volleyball. I presume it was his daughter, and she really loves playing volleyball. And he said it was kind of troublesome to him that he realized that was the last volleyball she was going to get to play for some period of time, and she really loves the game. But as soon as he had that thought, he also realized she was going to get to play again. There was going to be a day where everybody gets to play volleyball and basketball. There is going to be a day when we can be close to our grandparents. That day is going to come. We are going to get through this. We do have the ability to control our own destiny, and I'm confident we will fulfill that. I want to ask everybody to help out in this regard. With that, our next speaker is Jeff. Are you coming up, or who's next here? Dave? Yes, thank you. Dave Summers, Snohomish County Executive.
Thank you, Governor. We in Snohomish County are focused on several objectives. First of all is science-based decision-making. And I want to assure all of you that every action that you've been asked to take and all the sacrifices you've been asked to take are guided by science and by the recommendations of our professional health officers and professionals that know about these types of viruses and conditions. So even though you may not know anybody that's sick, take these actions seriously, please. They are designed to flatten the curve of the spread of the disease, which is vitally important, not only for the health of vulnerable populations, but also to make sure that we're matching the capacity of our health systems to address the sicknesses that comes through our communities. Also want to say that we are working 24/7. We have a lot of good people working very hard to form partnerships, very strong partnerships, and I thank the governor and Dow and others for really pulling together on this as a team. It's vitally important that each and every one of us, whether you're a city or a county or a business or an individual, really is working together on this. We need each and every one of you. So in Snohomish County, we stood up our emergency management system 3 weeks ago to coordinate our efforts within the county between cities, the county, private businesses, our health district, make sure that each and every partner is focused on what they need to do and what our priorities are to protect vulnerable populations and flatten the curve. We'll continue to build those partnerships. We're very grateful for the assistance coming in from the federal government at this time, and that's a welcome addition to the team that we have here in Snohomish County and Washington State. The last thing I want to say is personal responsibility, and I am also very proud of our citizens. It's clear, and residents are very clear that you are taking this seriously. As I drove in this morning from Snohomish County, it was a quick drive. We thank you for that. For those of you who are not taking this seriously, we absolutely, each and every one of us, depend on you to really take actions, the actions we're asking for you. At the end of the day, we can have partnerships and we can be guided by science, but each and every one of you as individuals needs to take action. You need to self-isolate. If you're sick, stay home. Take care of your elders and others around you. If you see somebody doing something stupid, say something. And just rest assured that we're going to get through this as best we can, as quickly as we can. We're going to be all right. We've been through tough times before, but with our partnerships and your personal responsibility and being guided by science, we're going to do just fine. So get out. It's going to be a beautiful week here in Washington State. Is the only state in the country that's dry this week. So get outside, order some takeout, and just practice your personal distancing and cleanliness. So with that, thank you.
Good morning. I'm Jeff Duchin, Health Officer for Public Health Seattle and King County, and I'd like to start by thanking Governor Inslee, Executive Constantine, Mayor Durkin, Executive Summers for their leadership and for being coordinated in our response to this unprecedented challenge. COVID-19 cases continue to increase in King County and Washington State, and we expect the cases to continue to double every 5 to 7 days unless we take action to significantly reduce community spread. The only way to do this is by decreasing the total number of people who get infected and can spread the disease to others, including to the many vulnerable people in our communities, in our families. This is what we mean by flattening the curve, decreasing the peak, the number of people who get infected at the height of the epidemic, delaying that peak, and spreading out the infections over time. And although most of us won't get seriously ill, if we don't take decisive action, the number of people that require medical attention ultimately could exceed the capacity of the healthcare system. So we need to make sure that anyone who gets seriously ill, our friends, our family members, our loved ones, will have the healthcare system there and able to take care of them should they need it. In order to do that, we have to work together and ensure that everybody is understanding the social distancing measures that we need to decrease close contact everyone has with others in the community. This is the most important way to decrease the spread of COVID-19. And although we call it social distancing, it's really physical distancing. We need to stay apart from one another to the greatest extent possible. And it's very important to understand this is not just for older adults and people who have underlying health conditions. We need everyone, younger people, healthy people, people who don't care about their own health, to understand that what they do impacts the health of the whole community. And they, although they will likely do well if they're young and healthy, can increase the number of cases in the community inadvertently, which will result in more serious infections and a higher strain on our hospital system if they don't practice this distancing. So we all need to work together to ensure that everyone does whatever they can do to avoid all non-essential gatherings and close contact. And I want to thank the people who are actually taking the effort and making significant, difficult changes in their lives to help slow the spread of disease. And I also, again, want to extend my sincere, heartfelt condolences to all those who have had this disease and who have had family members impacted by this disease. We understand that this outbreak and the response steps that we need to take are tremendously disruptive to our lives. But it is critical to understand by taking these individual actions to keep yourself healthy and to avoid contacts with others, we are protecting not only our own health, but the health of the community, the health of those who are vulnerable, and protecting the healthcare system. The actions that we're taking today are going to impact what will happen in our community weeks and months from now. 5 days ago, we announced initial measures to help limit the spread of COVID-19, and today we're announcing additional steps that we believe are required to further limit close contact in our communities. And you heard from Executive Constantine and Governor Inslee what some of those steps are. The unprecedented health threat that COVID-19 presents requires unprecedented individual and community action and cooperation. The reasons we're doing this now include a continued increase in new cases. We know there's about a 2-week time lag between the time someone becomes sick and when they need hospital care, and waiting for the hospital care system to become overloaded is not an option. Our public health surveillance data show that there have been higher levels of emergency department visits and pneumonia than we expect at this time of year. Our flu season is winding down, yet we're still seeing levels of emergency department visits and pneumonia hospitalizations that are comparable to the peak of flu season. Statewide data from Washington State Department of Health also shows increasing visits and hospitalizations around the state for people with symptoms that might be suggestive of COVID-19. And as you've heard, there's a growing consensus at the national, state, and local levels regarding the need to take all available actions to delay and lessen the spread of COVID-19. We need to impress on everyone the urgency of this situation and the importance of taking both governmental and individual actions. Therefore, as local health officer, I'm ordering that beginning today, March 16th, all events with 50 people or more are hereby prohibited until further notice, consistent with that action the governor has announced. In addition, events with fewer than 50 people are discouraged, and they're prohibited unless their organizers can observe the COVID-19 prevention measures that we have described. All bars, dance clubs, fitness and health clubs, movie theaters, nightclubs, and other social and recreational establishments shall be closed until March 31st or later if determined necessary. In addition, until March 31st, 2020, or later if determined necessary, all restaurants and food establishments shall cease providing dining room services but may remain open for drive-through, takeout, and delivery services and must adhere to the COVID-19 public health guidance for retail businesses and service operators. All other retail, including banks, grocery stores, hardware stores, and pharmacies, should and may remain open, provided they observe the COVID-19 prevention measures and adhere to the Seattle and King County guidance for retail and service operators. At this time, I'm going to conclude my remarks and will be available for questions.
So, as was described at the beginning, we do not have a full complement of reporters here. There's a pool camera. We are receiving questions remotely, and Chase, I wanted to have you sort of MC this part of it and make sure that we get the questions through from the reporters in an orderly way.
Sure. So please, everyone, remain muted unless you're called upon. We're going to unmute all the lines now. And first question to Rachel LaCour, AP.
Not hearing Rachel.
Are you taking questions?
First question to Rachel LaCour.